disability organization in the country. Most of the affiliates of the ARC were started by probably your parents. And, you know, they were in coffee shops and, you know, people's houses trying to figure out, you know, these, I used to call them the feisty parents, because these are the parents who says, you know, no, my kid's not going to an institution. They're coming home with me because this is my child. And they just really figured it out. And so I'm just really grateful to older caregivers and what they've accomplished in their years. So in Massachusetts, we're the state ARC. There's 17 affiliates throughout the state. And it's the affiliates that are actually the ones who provide the programs and the services. So our jobs at the ARC of Massachusetts is more about advocacy and legislation and disability policy. You know, we're work very closely with Beacon Hill, because without money, you know, I mean, we're not going to have good services. Legislative advocacy, just really helping our legislators understand the needs of families and individuals who have intellectual and developmental disabilities, what their needs are. Disability policy, what is good policy? I mean, we believe in inclusion, we believe in everybody having protected rights and that sort of thing. And then my job at the ARC is I get to do the education and the outreach. So I get to provide you folks with lots of information about supports and services. I was just telling Lucy, she said she learned something new all the time. I learn something every day in my job, and everything changes. So it's always a very, it's difficult. So these next slides are really about statistics that were done by the ARC of the United States does a FIND survey, which is the Family and Individual Needs Determinations survey. And basically, they also work with the state of the state. And then in 2015, they reported that 871,000 people across the country are living with caregivers 60 years of age or older. Now, I don't know about you, but 5 years ago, I was 5 years, no, it's more like 7 years ago, I was 7 years younger. So if you could imagine, this number has just escalated. Actually, the number of people who live with families is huge and across the country. And the caregivers are getting older. So we're actually in a national crisis, along with several other states. The other thing that the FIND survey found out is that most caregivers, or more than half, reported that they didn't have a plan for the future. I could tell you a story about 3 days after, it was 3 days after Christmas, and I got a call from an attorney that I work with who had a friend who called him, and the mom unfortunately unexpectedly passed away. He lived with his mom, this young man, he had Down syndrome. He lived with his mom as well as his sister. And his sister and his brother were both really just frozen. Didn't know what to do, didn't know who to call, didn't really know much of anything. So through a series of questions, you know, we pieced together that actually he had quite a few services, and we hooked them up with his service coordinator of the Department of Developmental Services. So just how important it is that caregivers do plan, and we really emphasize completing what we call a letter of intent. And if you can just Google letter of intent, and you will come to hundreds. I like the one that Affinia Financial Services has. It's online. It's easy to fill out. The ARC of the United States actually has a one that you can do as well. And it's a place to write down all that information So, you're preparing for the future. And that's just so important. So can you imagine if this mom had written down just who to call, who's his, who do you talk to at Social Security? What about the Department of Developmental Services? It would have saved an enormous amount of angst and worry for those brothers and sisters. So anyways, so what are we going to cover today? So we're going to tell you about benefits. This is a lot of you, I'm sure, have this information already. Please ask questions, interrupt me. I don't mind. This is going to be kind of basic, but I hope I can go deeper into any questions that you may have and really be able to talk a little bit about what I think is much more important than services is planning. Because, when you go to any of the state agencies that do provide these services, everyone has their own door. And I'll probably go to my next slide. Oh, wait a minute. All right, I'll go back. They have their own door, and every door has its own eligibility and their own way of doing things. And no, they don't talk to each other, unfortunately. So they, may say to you, oh, so what do you want? And, you're going to say, well, what can I get? What do you have? Whatever. And they'll go back to you, well, what do you need? So I'll give you some really fun frameworks and tools for planning. And so I find that people have a lot more success in working with state service agencies when they have that plan in for the future. We'll talk about navigating services. It's not easy, it's frustrating, but it can also, you're finding the right ways in the right people to speak with. It can make your lives easier. And also when you're having problems, who do you call? How do you advocate and that sort of thing? So first, we're going to go we're going to talk about financial. And so I imagine many of your brothers and sisters and loved ones do receive Social Security. SSI is Social Security, Supplemental Security Income. And, you get that because you have a disability that prevents you from making a gainful wage and that you're poor. So at this time, you can't have more than $2,000 in the bank to be able to do it. But, it can provide, I looked up how much they're getting, and it's up to $841 a month. And it's supposed to pay for food, clothing, and shelter. Receiving SSI is huge because a lot of our loved ones, they're not able to work and make gainful wage. I mean, look at costs and rents, they're ridiculous. And how do you pay rent? And that sort of thing. So this is very, very helpful for lots of people. So people can work when they receive SSI. That's kind of a fallacy that some people have about, oh, can't work because then you'll get your SSI cut. Well, it is true. They will reduce the amount of your check, but there is a way that you can work and get SSI. There are some organizations, Mass Rehab Commission for Transition Age Youth provides a benefits counselor. They can sit down, they can, show you exactly, this is how much money your loved one they could receive. For adults, Work Without Limits or Project Impact is another place that does benefits counseling. And these people are all trained by Social Security because Social Security wants you working. But they'll be able to tell you exactly what parameters you have, which are really, really helpful. The other part of SSI, which is huge for so many people, is that you automatically qualify for Mass Health, or that's Medicaid in Massachusetts. And Medicaid does pay for a lot of different types of services that can be really essential for families when you're, caring for a loved one. So we'll go into that a little bit later. And then there's SSDI, so Social Security Disability Insurance. And many of you with older parents may know about this because your brother or sister or loved one is what they call a DAC, or a disabled adult child. So when your parent reaches retirement age, or they also, pass on, your loved one with a disability can receive benefits based on that parent's income. So their checks are typically higher than just getting SSI. People can get SSI and SSDI, and there's no limits on income. They also receive Medicare, but after 24 months. And generally, you get more money when you receive SSDI. Sometimes people get knocked off their SSI benefits. And when they do, they lose their Mass Health, which can be a problem because that might be paying for some day programs or some in-home support services. But there is a program called Commonwealth, is for working disabled, and then also people who are over income who could still buy Mass Health benefits, but based on their income. So the thing is, when you do qualify for SSI, you qualify for a lot more services, which is a good thing, because basically you reach the poverty guidelines. You can get food stamps. Medicaid is paying for lots of different types of programs, including transportation, Section 8 housing vouchers. If you have SSI, you automatically qualify, and also fuel assistance. So there's several poverty type of assistance that your loved one can get. And, all these little programs and services, they add up. So, it's kind of a pain doing, the food stamp application, things like that. But it really can help to contribute to household income. And, especially when you have brothers and sisters coming to live with you, your expenses are going to be higher. So, good to take advantage. And then there's also something just to mention that's, I don't really know how long ABLE has been in the country, but what it is because, SSI is so restrictive. You can't have more than $2,000 in your name, else you don't qualify. Well, in Massachusetts, it's called attainable, and people can contribute up to $15,000 a year and up to $100,000 in lifetime to pay for different types of supports and that sort of thing. I apologize if I'm giving you dated amounts, but I believe these amounts have gone up a little bit. But they can pay for education, a car, transportation. They can help with housing, and so in Massachusetts, it's run by Fidelity Investments. The money is managed by them. But MIFA, which is the Massachusetts Educational Foundation Association, Mary Rubinis, she's the one who really knows everything about ABLE and is able to help people get accounts set up and that sort of thing. So it's a good thing. You also don't have to use the one in Massachusetts. You can go to any ABLE account anywhere in the country. So some people don't particularly enjoy the way Fidelity, handles the money and that sort of thing. So let's go into state services. And I like to show this because, it's all about government and the legislators and, and who controls the money and all that kind of good stuff. So this is just a little organizational chart. Under our governor, Charlie Baker, we have Secretary Mary Lou Sutters, who is our Secretary of Health and Education, Health and Human Services. And basically, she is the one who oversees all of these agencies for people with disabilities. So there's 6 in Massachusetts that she's overseeing, and which she also does the Soldiers Home in Holyoke. So anyways, these are the different agencies that are out there that can help and assist you with your loved ones. So let's talk a little bit about paying for medical stuff. Mass Health, it's there. It's there for people with disabilities. It's not the sometimes the easiest in terms of, if you need adaptive equipment or a special type of service. However, it does pay for a lot of significant expenses that people with disabilities can have. So in terms of, the healthcare, doctor's appointment, prescriptions, transportation to and from, medical appointments, dental care, hospitalizations, emergencies. The link there really kind of goes through all of the different services. But what most people and most families and individuals really take advantage of for Medicaid, is that it pays for what they call long-term support services. So if your loved one attends a rehabilitation program during the day, that's who's paying for it. It's Medicaid. They're also paying for the transportation to and from. So they may be eligible for services through the Department of Developmental Services, but it's Medicaid who's really paying the bill. I'm not sure if any of you are familiar with a program called Adult Family Care, or it used to be called Adult Foster Care. And basically what it does is, provided if you're not the guardian, it pays for the everyday care of an individual. So if you had your brother or sister living with you, or a loved one, you could be paid a tax-exempt stipend for providing the daily care that they need. Typically, the stipends amounts are based on the level of care need, and you can either qualify as a level 1, which is around $9,000 a year, or level 2, which is around $18,000 a year. But what it is, it's a tax-free stipend. So, and also it's your money. So you do with this money whatever you want. For some people, they need it for income because they can't work, because they have got a loved one they got to take care of. For other people, they're squirreling it away for their loved one's futures. And maybe they're making that down payment on something that, so they have another place to live. There's also personal care assistance, PCA. It's a little bit more medically oriented, and your loved one needs to require physical assistance in areas of adult daily living, personal care, that sort of thing, toothbrushing, dressing, that sort of thing. There's also group adult foster care. So I used to support a woman who actually had a group adults foster care. She was in a elder disabled housing complex, and they send in staff to assist with residents of those congregate living type of programs. So that's also a Medicaid program. A rehabilitation, which we talked about, and adult day health for people with more mental health needs, and also continuous nursing and home health aides. So it's kind of a long list, but a huge help for a lot of people. So there's 2 ways of being eligible for Mass Health, and one is, you're receiving, your loved one's receiving SSI, so it's automatic. You can also apply for it separately. The person must have a permanent and total disability, and they need to meet a level of care, of a nursing home or institutional care. But the majority of people who use Mass Health and use adult family care or a PCA or day habilitation don't live at all in a nursing home or institutional care. They're living at home with families. And then I mentioned a little bit about Commonwealth. And so for people who have a job, and that might be putting them a little bit over the income for SSI and Mass Health entitlement, but they can pay a premium based on their income, and they could receive all those services that I talked about in the last slide. So this is you'll all be getting a copy of this PowerPoint. This is a little bit more about where to find the Mass Health brochure and finding out far more about it. In all the services that they do provide, and they do provide quite a bit. So there's also, I call this the well-kept secret. It's called premium assistance. And so if you have your loved one on your family health care plan, your private health care plan, like Private Pilgrim or Tufts or Blue Cross Blue Shield, Medicaid is thrilled. Mass Health is thrilled. So they're so excited that they're going to pay you what you're paying out of your paycheck to carry the family health care plan. So say I have a daughter and she's 24 and she's still on my healthcare plan. She's got a disability. They take $200 out of my paycheck every week to help pay the premium at my job. Well, Mass Health is providing me with $200 a week of reimbursement, because again, you know, your private health insurance is paying for 99% of the bill. So again, it's a cost savings for Medicaid. They also will cover the cost of COBRA, which is just really reassuring. So for anybody who's lost a job or, out of work for whatever reason, they can also apply. You need to be eligible for Mass Health first before you apply. The application, it's simple. It's a one-pager, and you bring it into your employer. They fill out the health insurance stuff. You send it in. It's actually a pretty easy program. So you can check that out. It's on the Mass Health website, and there's also a phone number to be able to talk with somebody about premium assistance. So, I encourage you to do that, because, there's all these little pockets of money, and yeah, they're a pain. And it's separate paper, it's separate eligibility for, and that sort of thing. But putting it all together, it makes it well worth it. So now I'm going to go a little bit more into eligibility and programs of what's available in Massachusetts. And please forgive me, for those who have brothers and sisters out of state. I don't have, how New York does things and that sort of thing. But the big thing about, Massachusetts is, for services, you need to live here. So the whole question about domicile, or where does that person live, is foremost. So unless you're living here, either your brothers or sister are living here, you're not going to be able to get all the paperwork in and, then say, okay, his move-in date is, July 1st. And then that's when services will begin. Unfortunately, it doesn't work that way. However, I have known people who we helped support a family who used to live in Massachusetts. Their loved one, their daughter, moved into a group residence in New York. Wasn't doing well. Just too far from the family. I don't even know how she got to New York. I think they moved there for a short time. Anyways, she moved back to Massachusetts, and she was actually able to get services right away. So people can be flexible. But where do you begin with it all? Again, I'm going to talk to you a little bit more about planning, so that you're not, calling 50 million agencies that you may not need to be talking with. Some great resources are your local ARC or Family Support Center. There's family support centers all over the state of Massachusetts. Department of Developmental Disabilities funds them, and they have staff who are navigators who know all this kind of information. So if you're stuck, you have a problem, you need to know about a program or whatever, encourage you to give them a call. I put the websites for the Department of Developmental Services. So if your loved one has an intellectual disability, that's where they would get the most comprehensive services. They also have another door, which I'll go into a minute. And then there's Mass Rehab Commission. And Mass Rehab, their job is to help people find jobs. And actually, they work with all sorts of people with disabilities. So people with substance abuse disorders, mental health issues, intellectual disabilities, autism, just a host of disabilities, physical disabilities. And their job is to find people jobs. There's also the independent living centers, which are, again, all over the state. They're in different regions. In the past, they have been much more for people with more physical disabilities than intellectual disabilities, but those centers are really changing. And if I know one of you said that you have a transition age youth, look into they provide some contracts through Mass Rehab Commission called PREATS, or Pre-Employment Transition Services, and where they'll actually go into schools, different agencies, and will provide some really good hands-on job development, internships, soft skill kind of training, so that people are able to find jobs. There's also Mass Options, which is this was developed, I don't know, about probably at least 5 years ago, maybe 10. And it was a way for people to do one-stop shopping. People always complain about, oh my God, how many places do I have to call to get whatever? And this is kind of a streamlined service. And then there's also the Aging and Disability Resource Consortia. So they're called the ADRCs. And, many of your brothers and sisters and your loved ones are getting older. So they're able to qualify for services based on their needs and their ages. I worked with a gentleman, helped support a gentleman who has his own condo. He always worked all his life. He got one of those 403B condos, so he didn't have to put down a huge down payment. He lost his job. It was during COVID, and just it didn't make sense for him to be working, and it was in a school and all that kind of good stuff. And so I was kind of worried about that. He lives alone. His family, his parents are in their 90s, and his brother and his sister, they don't live, they live an hour away. They live in the Boston area. So my thing is, who's got to kind of keep an eye on this guy? And so we arranged for Meals on Wheels. Can Bruce cook? Yeah, he can cook. But, a few times a week, he gets home meals delivered. And you know what he also gets? He also gets a watchful eye looking to make sure he's okay. So that's a little bit about some of the programs you can get when you're getting older. And there's also the area offices on aging. So we worked closely with the Minuteman Senior Services, and they were great in terms of being able to provide some help in that sort of thing for Bruce. Another situation where the Senior Service Agency helped out was there was a young man who was diagnosed with autism, or on the Asperger spectrum, and his parents had both passed on. He had disabled housing in a very nice community. He drove. He had a part-time job, but he was lonely. And he didn't, his only social aspect with his sister was that who was actually living in the same town. But, his sister, she's getting older and kids of their own and, also had a job and that sort of thing. Minuteman Senior Services paid for. We wanted a companion because this guy was a little bit awkward about accessing community services. So the senior services actually gave the sister some money. So we helped her hire somebody to take him to the center and get him acclimated into the yoga class and a couple, he loves to go kayaking and a couple of other things so that he's not solely dependent on his sister. So this is how you can kind of mesh all these skills together in all these services. Mass rehab, so there are 4 big, responsibilities. I talked about vocational rehab. Their job is to find you a job. They will sometimes help pay for college courses that would help lead to a job, do assessment, do interest inventories. You're assigned a counselor. There's community living. So how do people with disabilities learn how to be more independent in their communities? They also are the ones who determine disability. So when you apply for SSI or SSDI, it's not just being poor. You've got to prove that your disability is preventing you to be able to work and make a gainful wage. So they're the commission that also does that. And then they also run the independent living centers. And like I said, these centers in the past have really been more for people with a physical disability, but they do serve a wide range of people. So these are the doors to DDS, I call them. And the door to the left is, you need to have an intellectual or developmental disability. But they also have another door where if you have a diagnosis of autism spectrum disorder, and you don't have an intellectual disability, that you can qualify for some services. The services aren't as plentiful as in the intellectual disability department within DDS, but they're helpful. A lot of times, people without an intellectual disability, that they might be people who have gone to college and they've gotten, they've gotten a degree. But they can't find a job because they can't get to work on time, or they can't really kind of figure out how to go through an interview. So it's all these types of other types of services that can be helpful for this community. Now, the big thing about having older brothers and sisters, and especially for you folks that have them in different states, keep the, look through those boxes of your family's homes and look for those evaluations, any kind of paperwork that showed, because when you apply for services from DDS, you need to show proof that this was an established disability for an intellectual disability before the age of 18. Now, many may not have that. They might have been a little quirky, especially if they're on the autism spectrum, and may not have had a problem with academics. They were just a little bit more unusual, maybe their social skills, that sort of thing. And so, a diagnosis was never really talked about because, they were doing well academically. But for people with intellectual disabilities, they want to see that they actually had a diagnosis before the age of 18. And this can be a problem, especially for families who have older individuals in their homes, in their families, because you probably didn't keep that. Your parents may not have kept that documentation. So what happens is a lot of times you have to go and get a neuropsychological examination, an appointment, which can take some time because there's some waiting lists. And you also want to make sure that therapist or that doctor has good knowledge of DDS regulations so that they're able to write in their report exactly what's needed. So for people with autism, it's a little bit, the age is not as young. And then, people can, they could have maybe had a diagnosis of what they, pervasive developmental delay or PDD or autism. And it risks, that you may have to get another evaluation because all of the criteria in the diagnostic service manual has changed. So now DDS goes right to that diagnostic criteria. If you go on this link, you will find out everything you need to know about eligibility. They really spell it out. The application is not hard, but two things to remember. You got to have that backup documentation, and you also have to have your loved one living with you. So that's a little bit about DDS. I see there's something in the chat. Let's see. Oh, thank you. So somebody asked a question about, they tried to work with Mass Rehab and they've never followed through or called back. Well, Mass Rehab actually kind of knows they really weren't very good with that. So we actually had a gentleman from Mass Rehab, Manel, speak on our Leo Live, which is our weekly Leo Sarkisian, our executive director webinar, just on issues and policy and budgets and all that kind of good stuff. And there's a Mass Rehab Connect. So what they've done is if you go back to Mass Rehab and you click on the link for Mass Rehab Connect, you should have a much better experience. The other thing is, I'm not shy, and you shouldn't be shy either, about, talking to the directors. So Tony Wolf, she's the commissioner of the Mass Rehab Commission. And, if somebody wasn't calling me back, she may not be a bad person to speak with. So, never feel that, never give up, because there's always something. Okay, so let's, why did my slide move? Sorry. Okay, we've been through that. Okay, so I'm back at DDS. So what do they have? They have service coordination or case managers. So if your loved one is eligible for DDS, they will get a service coordinator based on their needs. The level of what they receive from their service coordinator can vary. So actually the people who are placed have a little bit more active service coordinator. With the folks that live with families, a lot of times they refer them to the family support centers. So they're not as involved, but and then also if they do attend a day program or an employment program or that sort of thing, the service coordinator would most likely do an ISP. DDS also provides residential services. There's independent living, there's 24/7 supports, there's shared living. These, as you can imagine, they're not real plentiful. So it's not easy having a loved one being residentially placed. And I'll go through that in just a little bit about how they determine it. But with day and employment, there's community-based day based supports. And basically, it's for people who aren't ready for work yet. But they need community access. So they're out in the community, they're doing volunteer work, maybe they're going to the Y, maybe they're going to the grocery store, they're taking classes, maybe they're volunteering for Meals on Wheels. But they're generally, hopefully out of the building most of the time. Also, they provide job coaching. Typically, you don't get one-to-one job coaching for a long period of time, but for people who need that introduction, that orientation to work, they certainly can provide that. And then also they provide enhanced stay habilitation. So say your loved one either has extreme medical or behavioral issues, DDS will supplement the staffing so that they can get the care that they need. And then there's also the family support centers I talked a little bit about. So for people with autism, they certainly do get a service coordination. They call it their autism coordinators. They can get individualized supports, adult companion, individualized home supports, which means, either someone that or they know that they can hire to do some maybe skills training or community access and that sort of thing. Or you would get it through an agency. They can refer you to clinical supports. They also have a college navigator program. So Easter Seals out in the Worcester area provides college navigators because a lot of times our folks with autism need that little extra hand-holding to get around the campus, to get their assignments done, to access disability services and get accommodations. So these college navigators can help. They also can provide some assistance with community-based day supports, employment, and also family supports. Generally, the max amount of money you get with any kind of flexible funding through family support is $3,000. But it can be used for a variety of different things. DDS is kind of looked at in the past, 10 years, different ways of using your services. So before it was always traditional. So you went to an agency and you took that staff member or you took that program and you didn't have really much say in how to customize it. And so they looked to try to adopt more of a philosophy of looking at self-determination or the ability for the individual and the family to be able to access it a little bit more closely to what they need. So there's something called Agency with Choice, or AWC. It's a co-employment model. Basically, the agency handles kind of like that hiring, staffing, that paperwork, the taxes, all that kind of good stuff. They're the ones who cut you the checks for reimbursement and that sort of thing. They do take some money out for their own operations, but Agency with Choice, not every agency does this, but there is, if you go on the DDS website, there is a whole listing of agencies that provide Agency with Choice. Some families don't want all that nitty gritty. And then there's some families who want total self-direction. So they go to an agency called PPL, or the public-private partnerships. It's an agency that's just really a fiscal intermediary. So they cut the checks, they do the hiring paperwork, they do the taxes, that sort of thing. You determine how the budget's spent. You determine, when you need something, how to change it, and that sort of thing. So that model is probably the most flexible, but it's also, a lot more responsibility. So I'm going to check the chat again because I see that we've got another one. Oh, thank you. Okay, does your loved one need to be living with us or just in state? Yes, no, Adrian, they have to be living here. It's called domiciled. Yeah, that's a problem because, it can take up to a year for eligibility, believe it or not.
Does she have to be living in my home, or could she
No.
have her own apartment?
She could have her own apartment. So okay. There's a young woman who we help out, and she actually had a Section 8 up in the state of New York, her own apartment, and she got to transfer the Section 8 because they're portable all through the country. And so she rented a place in the greater Boston area. Her mom was nervous because she knew that she wasn't going to get services right away. And so she has another apartment in that same complex. And so she, as soon as she came here, she filled out the eligibility application. And, you know, I'm sorry to say it's been about a year, but she will be eligible and she'll get independent living supports and that sort of thing. So, you know, it's just great to have all that paperwork just completed and ready to submit the day they live, the day they move here. I worked with a family who wanted to move their son to from California. He's in a residential program. They moved back east and they want him closer. And so we met with the actual regional office. We met with the eligibility team and we gave them all the paperwork. There was, but not the domicile. But so the day he was going to be moving from California to the, you know, to the Boston area, he was going to go get his Mass ID license to prove it. That was their first thing to do. And then this family was in the financial means, but they also, I mean, this is what people have to go through. They also looked into, they private paid an agency to provide residential care because this young gentleman has real severe behaviors and really would not be safe at home. So there was no way he was going to be able to live at home for even a day. So that's how they resolved it. So anyways, not easy. Okay. I don't know why I can't. Oh, here we go. Okay, so if your loved one is living with you, you know, probably one of the main services you're going to get besides hopefully a day support service is family support. And there's family support centers all over the state. DDS pays for them. They do lots of stuff. They give out flexible funding. They have, some of them have different programs and services. Some of them are able to provide staff. So if you wanted to hire somebody to be a companion or a specialized instructor, they can sometimes be able to provide that. So these people that work at the centers are just phenomenal resources. So, you know, never forget you have that in your back pocket if you have any questions and that sort of thing. And you can look up what family support center is yours by the DDS website. There's a whole directory and that goes by, and it's by location. I apologize for this type being so tiny. I didn't realize that. But, you know, DDS also does the employment and day supports. You know, my heart goes out to the mom who says here's her, I don't know if it was your son or your daughter, still not back in a day program yet. You know, COVID has wreaked havoc on our service delivery system. And I know that's not very positive, wonderful news, but it's the truth. Many day programs have had to close. Many have only been able to open their doors, you know, halfway for folks because of, you know, restrictions, regulations, transportation, you know, space issues, that sort of thing. And the other huge issue that's going on across, and it's really across the country, it's just not in Massachusetts, is our whole staffing crisis. You know, I mean, you look around at any fast food restaurant, Walmart, you know, Target, I mean, they're all paying, what, you know, between $18 and $20 an hour. And our service providers aren't able to pay that amount. So, and, you know, let's face it, our direct support providers, they work hard and they do they do a lot of good work. So they deserve a meaningful wage. So the ARC of Massachusetts, we're very involved with advocacy around trying to get a better wage for people who work in these programs. So if you go on the ARC of Massachusetts and go to our action center, please, talk with your state reps and your senators. They need to know that your loved ones are really suffering because of the poor pay that we provide for people. So, but in terms of employment and day supports, that is something that DDS does provide. Some people I know, they're going on their third year of having nothing during the day. So these are, adult people with disabilities who had been attending maybe a day program, maybe a day hab, maybe they had a job, maybe they had a little combination of everything. But, they're at home and they're at home with their parents because no one else is able to care for them. So this is a real crisis. There's also Mass Health certainly pays for day supports, which is day habilitation, transportation, and as well as adult day health services, which are more for people with mental health needs. So again, and when I talk about these types of programs and services, you can get a combination. So I know lots of people use a little bit of maybe community-based day supports, which, that's the one they're getting out in the community, they're doing maybe Meals on Wheels, going to the Y, and that sort of thing. But maybe they go to day hab a couple of days a week because maybe they have some clinical needs. Even though day hab, you don't receive direct therapy like speech or occupational therapy or physical therapy, they typically will hire consultants who will train the staff so that their methods and approaches are done throughout the day. Okay, then there is residential. Getting residential supports from DDS is not easy. Basically, there are different ways that they can provide them. There's the, congregate living, the 24-hour residential supports, the group homes, we call them. They're, suffering the same dilemma with the lack of staffing. And then there's also, if somebody was able to have an apartment or live somewhat independently or in a family dwelling or whatever, there is individualized and community supports. So they can go in for about 15 hours a week and they can help out with maybe meals or doctor's appointments, prescriptions, whatever that person is needing more support in. And then there's also shared living. And shared living is actually something that DDS has really embraced in these past few years because, with group homes, you have that turnover. You've got staff leaving. So you got new hires, you got people who don't know your loved ones. And, you're lucky, there's some wonderful places out there. I'm not trying to say that they're terrible, but, you do run that risk of, your direct support staff not having a long-term relationship. So that's where shared living comes in. And that's living with a family or maybe a couple of individuals or an individual that's maybe their age, and they get that 24/7 support. But their needs are a little bit more focused on because they're part of that family or they're part of that individual's lifestyle. So that's something that DDS does provide for as well. People sometimes get confused between that and adult family care, but sorry about that. It's paid for by Medicaid, and shared living is paid for by the Department of Developmental Services. And they're monitored monthly by an agency and that sort of thing. I have a family that I help support, and basically, you know, they're older, they're retirement age. Well, actually, they're past the retirement age, and they're tired. They want their son settled, so they went the route of looking at congregate living or a group home, and they were really dismayed at what they saw. And so what they've decided is that they're going to go for shared living. So anyway, so his referral is out there to a couple of different agencies, and they're pretty excited about it, which is great. So how are services determined? Well, there's two ways, really. There's what they call the ICAP, or it's a comprehensive assessment tool. And what it is they assess the individuals. So the more needs that your individual has, obviously, the higher the score. The other thing they do, and especially when they live with caregivers, older care, is they assess the ability of the family to provide the care. So if you're healthy and, you're figuring it out and you're doing it, they're like, okay, you're set. So what they do from this ICAP is they give you a prioritization score, and you either get a 1, a 2, or a 3. And a 1 means you need it now. So a lot of times, older parents who have passed on or have to go into a nursing home, their loved one will probably score something higher because they're in need of assistance right away. A priority 2 means you need it, but you don't need it right now. So does it mean that you'll never get it if you're a priority 2? No, you'll, but you just have to maybe, it will take a little bit longer than if you are a priority 1. And then priority 3 is that you don't need it, which, quite frankly, I don't know anyone who doesn't need it. Now, the other big criteria that you're looking at is there's got to be available funding. And that's where the state government comes in, and our budgets, and making sure that there's money in our budget to be able to support our kids' needs and that sort of thing. And there's also placement issues. So we helped support a young woman who just turned 22. She was leaving a school that specialized in autism, excellent school. There was only, I think, 2 openings for adult services in that school, and she didn't make that fit. They felt that her needs really weren't going to be met in those different situations. And so unfortunately, she ended up going to a respite home for 6 months, or temporary housing. So will DDS come through and provide the service? Yes, they will. Is it what you want? Probably not. So let me check the chat again, because I see there's a couple more. Oh, you're welcome, Dawn. She has to leave. D. Does DDS require the use of the specific family support service in the area of residence, or there can be a choice of the family support agency? Typically, there is one family support center, but there are ways of being able to get it from other centers, especially if you're in the same region. So if you're not particularly happy with your family support center, I would talk with your area office and see if there's another family support center nearby that would be able to provide some services for you. Okay. Let's see. All right. Okay. So housing, this is a huge one, because it's like everybody kind of worries about, okay, where are they going to live? So who pays for it? How's it all funded? So, you got your state dollars, you got your DDS budget, you've got your Section 8. A lot of people, that's how they use their SSI money. That typically will help pay for room and board. Mass Health, special needs trusts will, I don't know if you or your family have done that financial estate planning. Important, because that can provide what I say, the good life for people with disabilities, not having it count against their Social Security income and that sort of thing. and it gives them far more choice and availability. A lot of times, you know, mom and dad are footing the bill. And then also, well, in you know, your paycheck or their paycheck is also something that helps pay for housing. So piecing it all together. So I also support this young woman who is in transition age. She's got one more year of school left. She's turning 22. And her family is using actually Mass Rehab, a home loan modification program, and putting on an extension to their home. And so in October, Miss Sam will be having her own apartment, which is really, really cool. And she will be on the Section 8 waiting list. And she'll get some independent supports from DDS, but she'll also have her family there. But she is so psyched because this is what it really going to be her first taste of independence. So, you know, there are different ways of doing things. Some great housing resources. We are so fortunate to have a woman named, her name is Kathy Boyle, and she runs Autism Housing Pathways. And by the way, your loved one does not need to have autism to access a service. She's a housing expert. And she'll whip through those Section 8 and other types of housing subsidies with you in about 2 minutes. You can also go on our website, and there's a step-by-step that she provides in terms of, you know, this is how you fill out a Section 8 and that sort of thing. You know, there's a centralized Section 8 waiting list, but also it's great to go to your own community because a lot of our communities have a housing authority. They also have elder disabled housing. And a lot of these places, those lists go faster because unfortunately, you know, they do have a lot of elders who live there and, you know, they pass away, there's openings and that sort of thing. So, and it's income based. So these are called project-based Section 8 type of apartments. So say your loved one doesn't want to live there anymore. You know, they can't take that voucher and go somewhere else, live somewhere else. It stays with the building. So I encourage you to go to your local communities as well as, you know, apply for the housing, the Section 8 centralized list. So this is my favorite part because I'm into, you know, I do a lot with person-centered planning. Yep. So Michaela, I'm just in the chat. Residential takes 75% of my brother's SSI plus his SNAP benefits. Okay. His food stamps, he has diabetes and he gets chicken nuggets and worse, no fresh vegetables and no exercise. What can I do? Every area office has a nurse. Also, wouldn't be a bad idea for perhaps your brother to go see a nutritionist. That
he
is, oh, he is, okay. And have they given the, well, I'm sure
yeah, they go with him.
They go with, yeah.
The new group that came in, we're going to start with meetings. And I said, you know, this is something where they need a menu plan. You know, you cook this at night and there's no deviation.
Yeah.
Because what else are you going to do? It's a lot easier than trying to teach them about diabetes. You know, as you said, they don't get paid enough to care about diabetes, you know.
Yeah. No, unfortunately. So, but there is a nurse in every area office.
ARC
So
area?
Pardon me?
Of ARC?
No, area office. The Department of Developmental Services.
Oh, okay.
Organized in different areas. What community does he live in?
Dedham.
Dedham. Okay. So I think they're the Newton, South Norfolk area.
Oh, okay.
And I would, you know, I mean, his service coordinator should also be part of the problem solving here.
Yeah.
So, and if you're not getting, you know, I'm one to kind of go up the food chain.
Mm-hmm.
So, you know, everybody's got a boss.
Okay.
And, you know, and your brother's advocate.
Okay.
And, you know, and if there's, things that just aren't okay. You know, having diabetes and not eating a diabetic diet, that's a problem.
Okay,
So, yeah, feel free to speak up. I mean, you can do it nicely. And, you know, unfortunately, it's the squeaky wheel, you know,
thank you. Okay,
that you got to do. So anyways, so this is when I went back to planning, I kind of talk about, you know, you're going to go to the state service and you're going to say, oh, so what can I get? You know, what do you have? And they're going to say, well, what do you need? And you're going to say, well, I'm not really, you know, she needs friends. She needs a house. She needs some staff to help her learn new things and that sort of thing. So anyways, the conversation, you know, doesn't always go great. And then you might get a list. Oh, well, you know, here's some links to these agencies. Give them a call, see what they do, and that sort of thing. So I'm an ambassador for Charting the Life course. It's a set of frameworks and tools that was developed by families. All the best things are always developed by families. And it was out in Missouri, in Kansas City. And so what I love about it is there's no jargon in Charting the Life course. So everything you and I talk about, like how do we stay healthy? What do we do during the day? What do we do? You know, where are we living? You know, all of that kind of good stuff. That's how they kind of organize their frameworks. They call them domains. And what I love is there's two tools that I think are just so helpful. And one is the trajectory. And it's an arrow up and an arrow down. And I'll be giving you the website. There's, you know, really colorful, very pretty, you know, handouts you can have that you can download for free and that sort of thing. But it's really about what you want and what you don't want. And it's about what do your loved ones want and don't want. You know, I never used to ask people, tell me what you don't want. I ask that question all the time because that is so important. And a lot of times, you know, people aren't able to articulate what they do want. Well, I want a friend, I want a boyfriend, you know, or whatever. You know, but when you start having conversations about what you don't want, you can get up to what you do want. You know, and you can make it pretty specific. So you can look at the next 5 years and say, okay, in 5 years, this is what we want. Especially for you, you know, for your brothers and sisters who are thinking that your loved ones are going to maybe be living near you because you want to be able to keep a watchful eye and be part of their lives, but that you don't want them living with you. So this is a great tool. They also on the website have a wonderful vision tool, which really kind of goes through all of these domains I talked about. So, you know, everything you and I talk about. Now, there's no jargon. There's nothing about disability. And so with the vision, you can kind of say, okay, I'm going to work on this right now. I want to work on community living because in 5 years, Bethany's going to come to Massachusetts and and I want her near me. And so I want to start putting things together and I want to make sure that we get it right. And so you can just really kind of focus on that. And it really kind of it takes kind of a pressure off because, you know, you really, it's a lot to think about. It's overwhelming, you know, to think about if you look at all of these domains, oh my God. So I got to keep them healthy. I got to keep them safe. I got to make sure they have friends. I got to make sure they have a place to live. I got to make sure they got something during the day. And, you know, I got to teach them how to speak up for themselves because self-determination is so important. So anyway, so, you know, choose one. You don't have to do it all. This star I love because and, you know, again, you don't have to have these fancy forms. You know, you've got 5 fingers. and, on your hand. And this is really what this is. And so, and I always start with the personal strengths and then the assets. What's your loved one really good at? What are their strengths? What's important to them? How are they best supported? And then we kind of move into that relationship, but who's in their lives? And, it could be staff, it can be family, it can be cousins, it can be neighbors. I did a person-centered plan with a young man. He had 20 people stuffed in his living room, all of his educators from the school, his neighbors, his family was all there. And it was just a really nice exchange of people knowing him in different ways. And then I also go over to technology because, I think COVID has really shown us how our folks can really step up to the plate in terms of their ability to use technology. And I think we also need to learn a little bit from our elders in terms of how technology can keep you safe in at home. I know a young man who's uses a care.coach. So it's an avatar, but behind the avatar is actually a real person. He used to drive his mother nuts because he used to call her every day saying, what do I wear? How cold? Do I wear my boots? Whatever. He's a pretty independent guy. He has a couple of roommates, has a job, that sort of thing, but, needed that constant type of support. So now he wakes up his dog. So they either give you a dog or a kitten for your avatar. And then he has great conversations with his support people behind the avatar. They even talk Boston sports. He's a huge Boston sports nut. His apartment, he's got some motor problems. He has a cerebral palsy as well as having an intellectual disability. And he has a Google house. He's a smart house. Technology has really come a long way in terms of helping people become more independent and safe. And there's DDS is doing much more concentration in this way. And Easter seals, there's a few places across the state that do assistive technology evaluations, Northeast ARC and the Northeast communities. So anyways, and then we go to community because community is important. I mean, staff are wonderful, agencies are wonderful, but do they really give you that quality of life that, some do, and, but it's so important to have other connections in your community. It can lead to jobs, it can lead to social opportunities, whatever, but that's something that, just important to really get your loved ones acclimated. And then the last part of the star that I talk about is supports and services. Are they important? Of course they are. We wouldn't know what to do without supports and services, but are they your sole concentration? No, because if you're concentrating solely on your supports and services, you're probably going to be disappointed. So anyways, it's a little bit about charting the life course. And this is the website. I hope you go on it. They do a lot with person-centered planning. They also have a really fun aging booklet, and they do it all the way from infancy through older. So they take all those domains, and based on their ages, they ask you questions about, helping you kind of plan some goals in those different domain areas. So that is charting the life course. Let's see, I'll check chat. Okay, recording. Okay, all right. So some advocacy tips. I've been giving you a few of them, but just
Carrie, I'm just going to interrupt for a quick moment. I wrote in the chat that, you're doing, I mean, everybody is just so focused. This is fantastic information. We're supposed to stop at 7:30. You don't have to. You don't have to. People don't
Oh,
have
it's
to
7.
jump up.
Well, I am at the
Up to you.
library, so I only have my study room. I lost my internet last night, so I'm at the library doing this. And I only have my study room till 7:30. So thank you for the
Oh, goodness.
reminder.
Oh,
I just
it's
have a couple more slides. And then I just really wanted to reiterate too that any of you who want to give me a call, happy to sit down and talk with you. And just do some brainstorming because I know it's not easy. Yeah. Anyways, so, follow up any conversation that you have with an email. Just to reiterate, this is what we talked about, blah, blah, blah. Take notes at a meeting if you can. If you can't, have somebody come with you and take some notes and then send it to the entire team. It's just a good way. This is my understanding, especially Michaela, I'm thinking of you where you're really worried about your brother and his diet. Just making sure that there's good conversation all the way around and that everybody, even though they may be not following through, will get the same page information. Make sure you include your service coordinator if you have one through DDS. They're important people. They're your advocate in that area. So, you want to have a good relationship with them. Sometimes, there's service coordinators that are better than others. So, to be totally honest, but, being able to have a relationship with them is important. I love this. I said, just do this all the time. Don't forget, everybody's got a boss, don't be afraid to go up to that next step. You're not stepping on anybody's toes. You can do it nicely. It doesn't have to be, mean or nasty or whatever, but it stems from your love and your concern for your family members. Make an appointment with that area director. So, Adrienne, I know you're thinking about your sister coming from New York. Well, that family that we help support in the greater Boston area, she met with the area director even before her daughter started living here. And you know what? It put a face to the paper. Because, when DDS gets these eligibilities, it's all about paper. It's all about reports. It's, narrow sites and, scores and all that kind of good stuff. And does that tell me who your sister is? Of course it doesn't. The other thing that is hard to remember, but we need to remember is that things are not an entitlement. We lost our entitlement when our loved ones left school. So, is it guaranteed? No. So does that make it harder? Yeah, it does. Documentation. I've gone through boxes of papers at family homes looking for that magic documentation that loved one had a disability, and we were able to scavenger enough papers to show DDS, yes indeed, look, he was receiving specialized services and that sort of thing. So look through those boxes. They're important. Some families kept them, others don't. And then brainstorm with others. I get my best information from families, and I learn something new every day. And so connecting with others, connecting with the Mass Sibling Support Network, awesome. Okay, so let's see. Here we go. Just some other kind of numbers for problem solving. We actually, if you go on our YouTube channel, we had the most wonderful webinar. There is a brand new department. It's about a year ago. It's called My Ombudsman. And I thought they worked for Mass Health. They don't. They are a separate agency. And so if you're ever having problems with your Mass Health or your loved one's Mass Health, give these people a call. She was just citing examples on how insurances, they'll even go beyond just Mass Health, how insurance wasn't going to pay for some home support services for a woman who was not quite ready to leave the hospital, and they intervened. And you know how exhausting that is to talk with insurance agencies and doctors and that sort of thing. So they really helped. At the Department of Developmental Services, we have Christopher Claxton. He's the ombudsman for DDS. And, you know, if something's not right, something's not going well, and you feel like you know, you need some extra help, give Chris an email. That's his job. Ombudsmen are there to solve problems. Can they solve them all? No. Does it always work? No. But, you know, hey, it's worth it. Worth the try. Mass Rehab also has one. His name is Mark. I couldn't find his email. I apologize. Family support centers, they're also wonderful resource for information, problem solving. They can share what they have learned from other families. So say you're stuck on getting something going, they can maybe help you out. And don't also never be afraid to talk with your state legislators. There is a family that we're helping to support, and he's going to school right now in Pennsylvania in one of those farm communities. And the family is really pushing DDS to have him back in Massachusetts, but have him have them pay for a portion of his care in Massachusetts. And actually, she got the answer she wanted when she called her legislators. Now, will that happen all the time? No, but you know, you just pull out all the stops.